Welcome back to Learn English Naturally. Today, we're going to dive into something that can be a little bit nerve-wracking no matter who you are, but especially if you're doing it in a new language. We're talking about going to the doctor.
Yeah, you're right. Healthcare is so important, but it's true, all those medical terms and the appointment process itself can be a little intimidating.
Yeah, exactly. But don't worry, we're here to help break it all down for you. By the end of this deep dive, you'll have the vocabulary and the confidence to handle a doctor's appointment like a pro. All in English, of course.
Yeah, think of this deep dive like your essential toolkit for clear and confident communication at the doctor's office, from the moment you call to make an appointment to when you pick up your prescription.
All right, so let's start with some of the basic medical vocabulary. We often hear this word symptoms. What exactly does that mean?
Well, symptoms are the physical or mental signs that something might be wrong with your health. It's how your body tells you something isn't quite right. And some common examples are things like fever or cough headache or a sore throat.
Okay, so if I have a fever and a cough, those are my symptoms. Now, how do I tell the doctor that I need to see them? Is it enough to just say, I need to see a doctor?
I mean, you could, but we can be a little more specific and polite. You could say something like, I'd like to schedule an appointment with the doctor, or I need to make an appointment to see the doctor.
I see, so being a little more formal can make a difference. What if it's an emergency? Is it okay to just say, I need to see a doctor right now?
Oh, of course, if it's an emergency, you want to be as clear and direct as possible. But for non-emergency situations, using those more polite phrases that we talked about can help to make sure that the interaction is smooth and respectful.
That makes sense. Now, what about if I need to see a specific doctor, like maybe one that specializes in something particular? Or what if I want to check to see if my insurance is going to cover the visit?
Those are great questions. For a specialist, you can say, I'd like to see a dermatologist, or I need to make an appointment with a cardiologist. It just depends on what you need. And then for insurance, you can ask, does my insurance cover this? Or will this visit be covered by my insurance?
Those are really helpful phrases to know. And it just occurs to me that pronunciation is going to be super important here. I mean, some of these medical terms can be pretty tricky to say.
Oh, absolutely. Clear pronunciation is so key for effective communication, especially in medical situations where misunderstandings could have serious consequences. Let's practice a few of those trickier terms. For example, cardiologist. It's not cardiologist, it's cardiologist.
That's a good catch. I can see how that one could be easily mispronounced. Are there any other words that we should be paying extra attention to?
Yeah, there are some. Words like cough and coughing can be tricky for English learners. Cough has that short, sharp sound, whereas coughing has that longer ing sound at the end. Another one is prescription. Make sure to emphasize the script sound in the middle. Prescription, not prescription.
This is really helpful. I think it can be easy to forget how important pronunciation is when you're focusing on just learning new vocabulary. So now that we've booked the appointment and we've practiced our pronunciation, what happens when we actually get to see the doctor?
Well, the doctor is likely going to start by asking you what brings you in, and that's when you're going to need to describe your symptoms.
Okay, so let's say I have a terrible headache and I've been feeling dizzy. How do I explain that? Can I just say, I have a headache and I feel dizzy?
You certainly can, and that's a great start, but the more information that you can give the doctor, the better they're going to be able to understand what's going on.
So what else could I say? I'm imagining the doctor needs a little more detail than just, I have a headache.
Exactly. Think about things like when the headache started, how often does it occur, and where's the pain located? You can say things like, I've had this throbbing headache for 2 days, or the pain is mainly on the right side of my head. And for dizziness, try to describe what kind of dizziness you're experiencing. Is it a spinning sensation? Do you just feel lightheaded? The more descriptive you are, the better.
That makes a lot of sense. It's almost like being a detective, isn't it? Giving clues to help the doctor figure out what's going on.
You got it. It's a partnership, and clear communication is key. And speaking of communication, let's talk about describing pain. That can be tricky even in your own native language.
Oh, I completely agree. How do we explain the intensity and the type of pain that we're feeling in English?
Well, there are lots of descriptive words that we can use. For intensity, you can think about words like mild, moderate, severe, sharp, dull, aching, or burning. And then for the type of pain, you could say it's a throbbing pain, it feels like a stabbing sensation, or it's a constant nagging pain.
Wow, there are so many different ways to describe pain. I never realized how important all of those nuances are.
They really are. And remember, don't be afraid to use gestures or point to the area where you're experiencing pain. It all helps the doctor to get a clearer picture of your situation.
This is all incredibly helpful.
Yep.
It feels a lot less daunting now that we're breaking it down step by step. But before we move on to the next stage of the appointment, let's pause for a moment. We'll be right back to continue our deep dive into handling a doctor's appointment in English. And we're back continuing our deep dive into how to navigate a doctor's appointment in English. We've talked about booking that appointment, practicing those tricky medical terms, and describing our symptoms. So now I'm picturing myself, I'm in the exam room feeling a little bit nervous, and the doctor says, "So what seems to be the problem? What do I do next?"
Well, that's your cue to put all that practice into action. Remember, you've already thought about your symptoms and how you're going to describe them. You've even practiced the pronunciation of all those keywords. So now it's just about clearly and confidently explaining what you've been experiencing to the doctor.
Okay, so I take a deep breath and I say something like, "Well, Dr. DeBercy, I've had this throbbing headache for 2 days now. It's mostly on the right side of my head, and it's been getting worse."
Perfect. You've clearly stated the problem, how long it's been going on, and the specific location of the pain. That gives the doctor a great starting point to work with.
So what happens next? I'm assuming the doctor doesn't just stop there.
Right. They're probably going to ask you some follow-up questions to get a more complete picture of what's going on. They might ask about other symptoms or your medical history, any medications that you're taking, or even about your lifestyle and your stress levels.
So it's really important to be honest and upfront about everything, even if it seems small or insignificant. Sometimes I tend to downplay things, especially when I'm nervous.
I understand. But just remember, the doctor is there to help you. The more information that they have, the better they're going to be able to diagnose and treat the problem. Plus, it's a great opportunity to practice using more specific vocabulary. Like, for example, instead of just saying, "I'm stressed," you could say, "I've been feeling overwhelmed and anxious lately because of work deadlines."
That's a good point. It's all about, painting a really clear picture for the doctor so they can really understand what's going on.
Exactly. And don't be afraid to ask for clarification. If you don't understand something that the doctor says, you could say something like, "Could you please explain that again?" Or, "I'm not sure I understand what you mean."
It's empowering to know that I can advocate for myself and ask those questions if I need to. What happens after the doctor's asked all their questions? I imagine there's some kind of examination.
Yeah, usually the doctor will probably want to physically examine you. They might listen to your heart and lungs, check your temperature, look in your ears and throat, or feel your abdomen. It's important to let them know if anything they do is causing you any pain or discomfort.
Are there any specific phrases that I can use for that?
Absolutely. You can say something like, "Ah, that's tender," or "That hurts a little if something's painful." If you need them to stop doing something, you can politely say, "That's quite uncomfortable," or "Could you please stop doing that?"
Okay, good to know. It's really reassuring to have those phrases ready just in case I need them. So let's say the doctor has finished the examination and they think they know what's going on. What happens then?
Well, at that point, the doctor is going to explain their diagnosis to you and recommend a course of treatment. That might involve lifestyle changes, medication, or even further tests. They'll probably also give you advice on how to manage your symptoms and how to prevent the problem from happening again.
This is where I think things can get a little confusing, especially if the doctor's using a lot of medical jargon. Is it okay to ask them to explain things in simpler terms?
Of course, it's totally acceptable to ask for clarification if you don't understand something. You can say something like, "Could you explain that in simpler terms?" Or, "What does that mean exactly?" Doctors are used to explaining things to patients who aren't medical professionals.
That takes a lot of the pressure off. I think sometimes we feel like we should understand everything that the doctor is saying, but it's okay to ask questions. It's our health after all.
Exactly. It's your body and it's your health, so don't hesitate to speak up and ask for the information that you need to feel comfortable and informed.
Now let's talk about medications. What if the doctor decides that I need a prescription? This is a part of the process that I always find a bit daunting, especially in a new language.
I understand it can feel overwhelming, but we can break it down into manageable steps. First, the doctor is going to write you a prescription. That's just a document that tells the pharmacist what medication you need.
And then I take that prescription to the pharmacy, right?
Right. And when you arrive at the pharmacy, you can just say, "I need to fill this prescription." The pharmacist will take your prescription and ask for some basic information like your name and date of birth.
What if I have some questions about the medication? Is it okay to ask the pharmacist?
Absolutely. In fact, it's encouraged. The pharmacist is a great resource for information about your medication. They can explain how to take it, what the potential side effects might be, and if there are any interactions that it could have with other medications or even with certain foods. Don't be shy about asking questions.
This is really helpful. It feels so much less intimidating now that we've gone through it step by step. But before we move on to the final stage of our doctor's appointment journey, let's take a quick pause. We'll be right back to finish our deep dive and equip you with all the tools that you need to handle any doctor's appointment in English. We're back for the final part of our deep dive into mastering those doctor's appointments in English. We've covered so much. We talked about how to book the appointment and how to describe your symptoms. We've even talked about how to understand the doctor's diagnosis and even how to navigate the pharmacy.
Yeah, it's been quite a journey. And you know what really strikes me is that even though we've been focusing on these specific phrases and vocabulary, the real key takeaway here is just the importance of clear and confident communication.
I totally agree. It's about being able to advocate for yourself, asking questions, and making sure that you really understand everything that's happening. It's easy to feel overwhelmed, in a medical setting, especially if you're doing it in a different language.
Yeah.
But having the right tools and the right mindset can really make all the difference.
Absolutely. And don't forget, it's not just about the words themselves. It's also about your tone of voice, your body language, and your cultural awareness. For example, in some cultures, it might be considered rude to be too direct with a doctor, but in a lot of English-speaking countries, directness is actually valued in medical contexts.
That's such an important point. So how can we make sure that we're being both clear and culturally sensitive at the same time?
Well, it's a good idea to just be aware of some of the common cultural differences in communication styles. For example, in some cultures, it's normal to use really indirect language or avoid eye contact as a sign of respect. However, in a lot of English-speaking cultures, direct eye contact and clear, concise language are seen as signs of honesty and assertiveness. It's all about finding that balance.
I'm thinking back to when we were talking about describing pain. It seems like that's an area where cultural differences could really come into play.
You're right. Some cultures might encourage you to be stoic and downplay your pain, while others might be a lot more expressive. It's important to be aware of those differences and to communicate your pain level as accurately as you can, even if it feels a little uncomfortable.
So if I'm from a culture where I'm used to kind of downplaying my pain, I might need to consciously make an effort to be more descriptive and more upfront with the doctor in an English-speaking context.
Exactly. It's all about adapting your communication style to the specific cultural context. And remember, it's always okay to ask for clarification if you're not sure about something.
This has been so insightful. I feel like I have a much better understanding now of not just the language, but also the cultural nuances that are involved in having a doctor's appointment in English.
And remember, practice makes perfect. The more you use these phrases and these vocabulary words, the more confident and comfortable you're going to become.
So as we wrap up this deep dive, what is the one key takeaway that you want our listeners to remember?
I would say it's this. Don't let fear or language barriers stop you from getting the healthcare that you need. With a little preparation and practice and cultural awareness, you can confidently handle any doctor's appointment in English.
Well said. And remember, folks, we're here to support you on your English learning journey. If you found this deep dive helpful, be sure to subscribe to Learn English Naturally for more episodes just like this one.
We'll be back soon with more tips and tricks to help you master the English language and navigate all those everyday situations with confidence.
Until then, stay curious, keep practicing, and take care of yourselves.
See you in the next episode.